Contagious bovine pneumoniae occurs in Africa and Asia where it is endemic. However, it can occur sporadically in the EU with imported cattle. The bacteria is Mycoplasma mycoides. It is an obligate pathogen. It is gram-negative and it's the smallest type of bacteria, with the smallest genome. It has no cell wall. The bacteria has surface proteins that help it avoid the immune system. And the clinical signs can be summarized with MACAPS, which means mastitis, arthritis, keratitis, pneumonia, and septicemia. The host range is cattle, buffalo, bison, and it can also affect sheep and goats, but they're asymptomatic. The bacteria spreads through direct contact in the respiratory discharges. There's a high morbidity and low mortality. It spreads slowly. It enters the body through the aerogenic route, and then it takes place in the lungs where there's lobular fibrosis and pneumonia. And then there's often an intracanicular spread from one lung to the other. There can also be thrombosis which cause the blood vessels to sequester. And in young animals only, there can be extrapulmonary lesions in the kidney, the joints, and under the eyes. For clinical signs to appear, it usually takes months, and then they'll have a dry cough, dyspnea, and in the pathology we can see fibrinous pneumonia, fibrinous pleuritis, and yellow thoracic fluid in the body cavity, as well as a marbled-like lung lesion. They also have decreased milk production, and in chronic cases they can get arthritis. It is a notifiable disease. For the diagnosis, you can use PCR, IF, immunohistochemistry, CFT, and ELISA. And for treatment, you only treat in endemic areas, not in Europe, and do not give penicillin, as there's no cell wall in mycoplasma, so it can't work. Instead, give thiamulin, fluoroquinolones, and aminoglycosides. Since it's a notifiable disease, you need to have stamping out, movement restrictions, and a closed herd, and serological testing. And in endemic areas, you can have vaccination. It's an attenuated vaccine, and it needs to be given every 6 to 12 months. For Mycoplasma of swine, the first disease is Mycoplasma enzootic pneumonia. It is caused by Mycoplasma pneumoniae. It is worldwide and it's common in large-scale farms, and it has a high economic impact. Only swine is susceptible, and it affects growers aged 3 to 6 months old. It is part of porcine respiratory disease complex. It is a facultative pathogen and requires predisposing factors. It is highly contagious, and there's a high morbidity and low mortality, and there's a slow spread within the herd. It is often subclinical. It often damages the respiratory epithelium and the alveolar macrophages, which releases cytokines. It is confined to the respiratory tract. There is no septicemia. In the clinical signs, we can see a dry cough and conjunctivitis. It is frequently asymptomatic. And in the pathology, we can see interstitial pneumonia and atelectasia in the anterior lobes. There is often yellowish thoracic exudate surrounding the lungs. It is often diagnosed with the slaughterhouse lung score, but it can be also diagnosed with using a PCR and indirectly using CFT. ELISA typically doesn't work due to it being confined to the respiratory tract. And Mycoplasma hyorinus has an increased prevalence nowadays. It is an epiphyte in the upper respiratory tract. It is mostly asymptomatic. However, in young pigs between the ages of 3 and 10 weeks old, it can cause pneumonia. And there is also septicemia. It can spread to the joints as well as causing conjunctivitis. To treat it, you give lincomycin and clindamycin. And Mycoplasma hyosynoviae is milder. It's a part of the upper respiratory tract and affects older animals between the weights of 30 to 40 kilograms, and it causes arthritis. You only test with PCR, no serology, and there's no vaccine. Chronic respiratory disease is caused by Mycoplasma gallisepticum. It is found in chickens and turkeys and other bird species. It is transmitted horizontally in tracheal discharge, and there is also a germinative infection. There is a high morbidity, and the mortality depends on secondary infections, especially from E. coli. It can enter the body through an aerogenic route or through a germinative infection, and it colonizes the epithelial cells, and it causes surface erosions. And then they enter non-phagocytic cells, and by doing this, they're able to avoid the host's defense, and they are resistant to therapy. And because of this, a chronic infection develops. In the clinical signs, it's frequently asymptomatic. However, there can be airsacculitis and dyspnea. There is also decreased egg production, and in turkeys, they get infective sinusitis, which they have very swollen sinuses. In the pathology, we can see cloudy fibrinous air sacs and conjunctivitis and mucus in the trachea. And in turkeys, sinusitis is like the main sign of this disease. To detect the bacteria, you can do PCR, IF, and ELISA. You can try treat the disease temporarily using antibiotics such as fluoroquinolones, aminoglycosides, pyrimidines, and macrolides. There is a live attenuated vaccine. It is effective for long-term protection. It colonizes the upper respiratory tract and it gives mucosal immunity. There is also a vector vaccine. It is based off the pox virus. It can be applied to antibiotic treatment. It is given to turkeys and chickens. The live attenuated vaccine is way more used in Europe. Infectious synovitis is caused by Mycoplasma synoviae. It is much more frequent and it's more fastidious. The bacteria lives in the upper respiratory tract and it can then have septicemia and go to the joints and the rest of the respiratory tract. In the clinical signs, we will see swollen joints and limping and arthritis. It can be diagnosed using PCR, but there's no ELISA. It spreads mostly through horizontal transmission, and there's also vertical spread. It's a germinative infection, but only in acute cases. For prevention, there's a live vaccine. You have the MSH, which is an eye drop vaccine, and then the MS1, which is a spray. The next bacteria is Mycoplasma milligridis. Milligridis is the Latin for turkey. It occurs worldwide, however it's occurring less and less due to eradication programs. The host is mostly turkeys, but it can infect other species such as chicken and peacocks. This bacteria has two types of pathogenesis. There's the viridial pathogenesis and the aerosol pathogenesis. Mycoplasma milligridis is in the reproductive tract. There is vertical transmission, so it is a germinative infection. However, if it is in the lungs, there is no germinative infection, but it can still spread horizontally. As a result of the vertical transmission, there is a disease called turkey syndrome 65. It affects pullets that are 1 to 6 weeks old. Their hocks often fill up with fluid, and their vertebrae are deformed. Other clinical signs between the two types are, in young animals, decreased hatching and embryo mortality and stunting, and in adults, they can get airsaculitis and decreased egg production. This bacteria has no vaccines. And the last bacteria is Mycoplasma ioa. It is worldwide, but the occurrence is less and less due to eradication programs. It is part of the alimentary canal in turkeys. There can be germinative infections and horizontal infections. Germinative infections cause the turkey chicks to have leg deformities, curled toes, and curved bones. And from horizontal infections through fecal contamination, young chicks in the hatchery can also get leg deformities, curved toes, and curved bones. There is no serology. It can only be diagnosed directly using PCR and isolation. And there is no vaccine. There is no humoral response. For the treatment, you can give tetracyclines, pyrimutalones, and macrolides.